Alere, knowing now matters. The Alere Determine HIV-1-2 antigen antibody combo procedure training for serum and plasma samples. The Alere Determine HIV-1-2 antigen antibody combo is an immunochromatographic test for the simultaneous and separate qualitative detection of free non-immunocomplexed HIV-1 P24 antigen and antibodies to HIV-1 and HIV-2 in human blood. Test kit components. Each Alere Determine HIV-1-2 antigen antibody combo kit contains 1 aluminum Ziploc pouch containing either 5 test cards with 25 test units or 10 test cards with 100 test units, a desiccant package, chase buffer, a quick reference guide, package insert, subject information notices, a customer letter, disposable capillary tubes for collection and transfer of fingerstick samples, and disposable workstations. Materials required and available as an accessory to the test kit. Alere Determine HIV-1-2 antigen antibody combo controls. Each kit control box contains 4 vials, 1 non-reactive control, 1 HIV-1 reactive control, 1 HIV-2 reactive control, 1 HIV-1 P24 antigen control. Materials required but not provided. Clock, watch, or other timing device. Precision pipette capable of delivering 50 microliters of sample with disposable tips, to be used in lieu of the disposable capillary tubes supplied with the kit, for other than fingerstick whole blood specimens. Disposable gloves, biohazard disposable container, collection devices for specimens, other than fingerstick whole blood specimens. Test and sample storage requirements. The test kit or aluminum Ziploc pouch containing test cards and chase buffer must be stored at 2 to 30 degrees Celsius or 36 to 86 degrees Fahrenheit until expiration date. Serum and plasma specimens may be stored at room temperature, 15 to 30 degrees Celsius, for up to 2 days before testing. If testing will not be performed within 2 days of sample collection, serum and plasma specimens should be stored at 2 to 8 degrees Celsius if the test is to be run within 7 days of collection. If testing is delayed more than 7 days, the specimen should be frozen, minus 20 degrees Celsius or colder. Mix specimen well by gentle inversion of the tube immediately before testing. Avoid repeated freeze-thaw cycles. Specimens that have been frozen and thawed more than 3 times cannot be used. All frozen specimens must be centrifuged at 10,000 G for 5 minutes at room temperature. Carefully remove the 50 microliter test sample from the supernatant. If a lipid layer is formed on the surface of the liquid, ensure that the sample is taken from the clear liquid below that layer. Test preparation. Open the aluminum Ziploc pouch containing the Alere Determine HIV-1-2 antigen antibody combo test cards. Remove the desired numbers of test units from the 5 or 10 test unit card by bending and tearing at the perforation. Removal of test units should start from the right side of the card to preserve the lot number, which appears on the left side of the card. Return the unused test units to the aluminum pouch and close the pouch with the Ziploc. Store the unused cards and test units only in the aluminum pouch containing the desiccant package. Carefully close the Ziploc so that the cards are not exposed to ambient humidity during storage. Remove the protective foil cover from each test unit. Lay the test unit flat in the workstation. The test should be initiated within 2 hours after removing the protective foil cover from each test unit. Do not touch the sample pad with your fingers. Note, use of the workstation is optional. If the workstation is not used, place the test unit on a flat surface. Serum or plasma procedure. Apply 50 microliters of sample by touching the tip of the precision pipette to the sample pad. Do not add chase buffer when using serum or plasma specimens. Read the test result between 20 and 30 minutes after the addition of the sample. Do not read the test results after 30 minutes. Interpretation of results. Antibody reactive. 2 lines, control line and antibody line. A pink-red control line appears in the control area, and a pink-red antibody line must appear in the lower test area of the test unit. The intensity of the antibody and control lines may vary. Any visible pink-red color in both the control and lower test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 and/or HIV-2 antibodies have been detected in the specimen. The test result is interpreted as preliminary positive for HIV-1 and/or HIV-2 antibodies. Antigen reactive. 2 lines, control line and antigen line. A pink-red control line appears in the control area, and a pink-red antigen line must appear in the upper test area of the test unit. The intensity of the antigen and control lines may vary. Any visible pink-red color in both the control and upper test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 P24 antigen has been detected in the specimen. The test result is interpreted as preliminary positive for HIV-1 P24 antigen. A test result that is preliminary positive for HIV-1 P24 antigen in the absence of reactivity for HIV-1 or HIV-2 antibodies may indicate an acute HIV-1 infection in the test subject. In this case, the acute HIV-1 infection is distinguished from an established HIV-1 infection in which antibodies to HIV-1 are present. Antibody and antigen reactive. 3 lines, control, antibody, and antigen line. A pink-red control line appears in the control area, and a pink-red antibody line must appear in the lower test area, and a pink-red antigen line appears in the upper test area of the test unit. The intensity of the antibody, antigen, and control lines may vary. Any visible pink-red color in the control area, the lower test area, and the upper test area, regardless of intensity, is considered reactive. The test result is interpreted as preliminary positive for HIV-1 and/or HIV-2 antibodies and HIV-1 P24 antigen. Non-reactive result. 1 line, control line. A pink-red control line appears in the control area of the test unit, and no pink-red antibody or antigen line appears in the lower test area and the upper test area of the test unit, respectively. A non-reactive test result means that HIV-1 or HIV-2 antibodies and HIV-1 P24 antigen were not detected in the specimen. Invalid result. No control line. If there is no pink-red control line in the control area of the test unit, even if a pink-red line appears in the lower test area or the upper test area of the test unit, the result is invalid and the test should be repeated. If the problem persists, contact Alere technical support. The Alere Determine HIV-1/2 Antigen Antibody Combo Test Kit, detecting HIV earlier at the point of care than ever before. The first and only FDA-approved rapid point-of-care test that detects both HIV-1 and HIV-2 antibodies, as well as free HIV-1 P24 antigen. A 4th-generation rapid test with the ability to identify HIV earlier than 2nd and 3rd-generation antibody-only tests. This enables healthcare providers to diagnose HIV infection earlier, allowing individuals to seek medical care sooner. For more information, please visit alerehiv.com/US.